5 tips to control eczema in adults and children. Itchy, flaky, sore, and irritating. If you or your child has eczema, you know just how frustrating these painful rashes and flare-ups can be. Luckily, you can keep eczema under control and stop the itch before it occurs by following these 5 simple tips. Hello and welcome to MedTouch, the best place to find the right medical information. Eczema is a group of non-contagious chronic skin conditions. Whilst the precise cause of eczema is unknown, research shows that eczema is caused by overreactive immune systems, which combined with environmental triggers and stress, causes inflamed, itchy, and irritated skin. Eczema may affect any part of the body, however, it usually appears on the arms, hands, elbows, knees, face, and scalp. Although there's currently no cure for eczema, there are steps you can take to manage your condition and prevent itchiness and inflammation before it occurs. That's why in today's video, we're sharing 5 tips that you can use to help keep your eczema or your baby's eczema under control and prevent unwanted, painful flare-ups. Tip 1. Identify and avoid triggers. Eczema affects millions of people worldwide, including both children and adults. However, it affects everyone very differently, so it's important to carefully identify and avoid common triggers that cause your symptoms to worsen. Some possible triggers to avoid include dust mites, fragrances, hot water, humidity, cold weather, pet dander, pollen, smoke, stress, wool, and synthetic fabrics. To help avoid some of these common triggers, try dressing yourself and your child in soft fabrics, such as cotton, and always use gentle, soap-free hand washes and detergents. It's also helpful to monitor the air quality in your home in order to minimize any exposure to allergens such as dust, smoke, or dander. Itching is also a major trigger for eczema flare-ups. The more you itch, the more inflamed and irritated your skin becomes. If your child has issues with itching, keep their fingernails short or use cotton gloves at night to prevent night scratching. During painful flare-ups, it may also be helpful to use wet wraps after bathing and applying ointments. Wet wraps help to keep the skin calm and hydrated so you and your little one can get some much-needed relief during the night. In rare cases, certain foods may also cause flare-ups and rashes in children. If you think this may be the case, see your doctor for allergy testing in order to identify any necessary dietary changes. Tip 2. Avoid harsh soaps and alcohol-based products. Soaps and detergents that contain harsh chemicals can remove the protective layer on the top of your skin, causing it to become dry, irritated, and prone to rashes and flare-ups. Aim to use products that are soap-free, fragrance-free, dye-free, and paraben-free. You should also avoid using waterless antibacterial cleansers that contain alcohol and solvents that are very harsh and drying on your skin. It's also important not to scrub your skin when washing, and always gently pat your skin dry and apply a good quality moisturizer immediately after drying. Tip 3. Take a warm bath. One of the most effective ways to prevent eczema flare-ups and keep symptoms under control is to take a warm bath each day. Soaking your skin in warm water is not only relaxing and stress-relieving, but it also activates enzymes in your skin that form protective biolayers and promote healing and prevent moisture loss. Soaking is also a great way to kill any bacteria that may be contributing to itching, redness, and scaling. For this method to work effectively, make sure your bath time is limited to 10 minutes or less, and the temperature of your water is lukewarm, not hot. You should also avoid using soap-based cleansers and scrubbing the skin with a cloth or a loofah. If recommended by your doctor, certain treatments can also be added to the bath for extra relief, such as gentle, fragrance-free bath oils or mild diluted bleach. Most importantly, once you've finished bathing, gently pat your skin using a towel, apply any prescription topical ointments, and then immediately apply recommended moisturizer all over the skin while it's still damp to prevent any dryness or irritation. Tip 4. Prevent your skin from getting dry. Keeping your skin moisturized is one of the most important things you can do to help keep your eczema under control. This is because eczema causes damage to the barrier of your skin, making it sensitive to certain triggers such as irritants, bacteria, humidity, and cold temperatures. When your skin barrier is damaged, it can be much harder for your skin to retain water, which increases your likeliness of experiencing an eczema flare-up. You can prevent your skin from getting dry by drinking plenty of water every day, avoiding harsh soaps and detergents, limiting time spent in the shower or bath to 10 minutes or less, and by keeping your skin warm and covered during cold or windy weather. In addition, it's important that you use a good quality daily moisturizer that works well for you and your child. Moisturizers should be applied several times a day, including right after bathing or exposure to water. And remember, not all moisturizers are created equally. Some may actually make your eczema worse. The best moisturizers to use are the ones that feel oily. These contain more oil, which make them more effective at hydrating your skin and helping to keep your symptoms under control. If in doubt, speak with your pharmacist or healthcare professional. Tip 5. Seek medical advice. If you're having trouble managing your symptoms and preventing unwanted flare-ups, speak to your doctor as soon as possible. Living with eczema can cause severe discomfort and pain, which can interfere with your sleep, mental well-being, and overall quality of life. The sooner you're able to control your symptoms, the better chance you'll have of preventing any serious side effects, such as local skin discoloration, scarring, skin dysfunction, skin infections, and systemic infections. Your doctor will provide you with a treatment plan, which will likely include prescription medication, including topical steroids and antihistamines. Your doctor may also recommend topical biological therapy, which is a type of treatment that targets specific points of the body's immune system response in order to find and block proteins that cause inflammation and that may trigger eczema. Eczema can also cause feelings of distress, anxiety, and depression. So if you or your child may be in need of extra support, reach out to a mental health care professional. There you have it. 5 tips to keep eczema under control and prevent painful, unwanted flare-ups. Thank you for watching. Be sure to like this video, subscribe, leave us a comment, and turn on that notification bell so we can stay in touch.